Hi, my name is Danielle Fixler. I'm a licensed clinical social worker and a perinatal mental health certified clinician. I work at Wildflower Center for Emotional Health as a staff psychotherapist and a clinical supervisor. Some of the areas of focus that I work with are mood and anxiety disorders, grief and loss, relational and health anxiety, and relational and health trauma, sex and sexuality, and challenges around the perinatal period, including decisions around the perinatal period, fertility challenges, pregnancy loss, pregnancy after loss, identity and relationship changes throughout the perinatal period as well. I would describe myself as a warm, compassionate, and supportive therapist, as well as direct and active. What I mean by this is that I am not a blank slate therapist. I am not going to just sit there and be a blank slate, not speak, not have any affect on my face until maybe a client gets nervous enough to spill their guts. I'm a very relational therapist, so I believe in building that rapport, building that connection over time, building that trust, and working towards sharing, working towards a client feeling comfortable being able to share. A lot of clients who start therapy for the first time or not the first time have already have had really negative experiences in institutions that are set up to help us, like healthcare settings, like therapists or doctors may have experienced medical trauma, neglect, invalidation, discrimination. And I'm very aware of this when a client enters the space, that they may not inherently trust the therapist or trust that the therapy process can help them. So it's my job to build that connection and build that trust, to go at their pace, to provide a lot of psycho ed around what I'm seeing, providing very direct feedback and my clinical recommendations and observations, a lot of choices around the path that we take, as well as, most importantly, going at their pace, taking it slow, and continuing to check in around how things are going throughout the process. Some of the interventions that I utilize are body-based, mindfulness-based approaches, acceptance commitment therapy, dialectical behavioral therapy, exposure and response prevention, and behavioral skills. I take an eclectic approach to find the best interventions to serve the unique experiences of my clients and pivot when things maybe aren't working as well or this feels like it's a better fit. As I've said previously, the most important thing to me is the relationship and cultivating safety, affirming my clients as their unique self, and that they like the therapy experience, that they like me, right? Like, therapy's hard. It can be uncomfortable, it can be awkward. And you're not always gonna like me, and that's okay. But you should feel comfortable and the relationship should be good enough. There should be a level of joy and laughter enough that makes it palatable to get into the hard stuff when we're ready. Because if that doesn't exist, then there's really no point to even trying, right? That's really damaging. You have to come back every week and you want to like the person that you're talking to. So if that sounds like it's a good fit, feel free to connect, and thank you so much.